Namaste and Siddhi Pranam. Welcome to your today's topic, the pelvic floor muscles, its anatomy and importance. We begin with the first topic as reclaiming female empowerment through pelvic floor exercises. And what do we mean here by reclaiming female empowerment? So for centuries, female sexuality has been, hidden in secrecy, shame and superstition. And even the terminology surrounding female anatomy has carried negative connotations, perpetuating to a cycle of discomfort and misunderstanding. But a new narrative is emerging, one that embraces openness and acceptance of every aspect of a female body. And among these aspects of a female body, the most important one is the pelvic floor, which really demands our attention and care. So to understand pelvic floor muscles, you can imagine a large bowl that forms a pelvic with a hammock-like pelvic muscles strung across its top edge. So these muscles provide crucial support for the internal organs, including bladder, rectum, and the reproductive organs. However, when the pelvic muscles become weak, they can lead to issues like prolapse or incontinence. So it is therefore, really imperative for women to become aware of these muscles and exercise them to improve their overall health and well-being. And so next will be, recognizing the significance of initiating pelvic floor exercises before pregnancy itself. So women can set the stage for a healthier pelvic floor during and after childbirth. And there have been a lot of studies that shows that experiencing urinary incontinence during pregnancy doubles the likelihood of facing similar issues 3 months after the delivery, regardless of the delivery method. So the weight of the growing baby during pregnancy can significantly weaken the pelvic floor muscles, and tears may even occur before birth. So these muscles really play a very pivotal role in supporting the uterus and the lower back, and offers stability and preventing pain in the spine, as well as sacroiliac joint and groin. So locating the pelvic floor muscles marks as a first step towards the effective exercise of pelvic floor muscles. And one approach involves halting the flow of urine midstream to identify the involved muscles. So what if you really want to pee and you're trying to control that? That's the same muscle that you're trying to use for just halting the flow of urine. That are the same muscles that are involved in the pelvic floor muscles. So they are the same muscles that works here. So though this should not be really practiced regularly to avoid potential infections, but just to know that these are the muscles that are engaged when we are exercising pelvic floor muscles. So alternatively, what women can actually do, maybe in a private space, a woman may explore manually by feeling inside with 1 or 2 fingers and contracting the muscles to discern and squeeze or lift. So that is another way of really knowing that you're right on point to know which muscles to exercise and whether you're able to squeeze them properly or not. So let's understand the anatomy of the pelvic floor muscles. So once again, I would urge you to imagine like a large bowl forming the pelvis with hammock-like pelvic muscles strung across its top edge, which you can probably see in the picture as well. So these muscles really provide, once again, crucial support to the organs that we discussed. And whenever they are weak, they can lead to incontinence or prolapse. We'll discuss prolapse in detail ahead. So it's really vital that women are aware of the importance of these muscles. So as you can see in the diagram, this whole picture represents the pelvic floor muscles, wherein there are different parts also. For example, the vaginal canal and the vagina. Everything is included in that, but there are various layers of muscles that act upon as a cushion to our organs, and different layers have a different role to play in the anatomy of the pelvic floor muscles. So let's understand the layers of the pelvic floor muscles. So the pelvic floor muscles have about 3 layers, and the first is the superficial layer, intermediate layer, and the deep layer. So the superficial layer, this is the outermost layer, and it consists of large flat muscles. And the two main muscles in this layer are bulbocavernosus and the ischiocavernous muscles. So these muscles help in stabilizing the erectile tissues, both in male and female. And in addition, they also contribute to the voluntary control of urine flow and also play a role in sexual function. Now the next is intermediate layer. So beneath the superficial layer, we find the intermediate muscles, and most prominent muscle in this is kind of most prominent muscles in the superficial transverse perineal muscles. So these muscles really assist in supporting the pelvic organs and maintaining the continence by helping to close the opening of the vagina in female and the anus in both male and female. So that is what the role that this intermediate layer has to play, which is a very vital one, and it stays for lifelong because it helps you operate both your sexual organ as well as anus. So the next layer is the deep layer, which really consists of most another critical pelvic floor muscles, including the levator ani as well as coccygeneus muscles. So the levator ani muscle is also known as the pelvic diaphragm. It is a broad muscle group that forms the greater part of the floor of the pelvic cavity. So to understand the levator ani in a little in detail, so the levator ani muscles can further be divided into 3 parts, which is puborectalis, the pubiococcygeneus, and the iliococcygeneus muscles. So these muscles really provide the vital support to the pelvic organs, including the bladder, uterus, and the rectum. And they work like a muscular sling to lift and hold the organs in their proper position. And the attachment of these pelvic floor muscles are essential for their proper functioning. So the levator ani muscles attach to the pubic bone in the front and the cox, that is the tailbone, in the back. So the superficial transverse pineal muscles run horizontally between the sit bones and connects the external genitals also. And the coccygeneus muscles attaches from the spine to the ischial spine, basically. So coming on to what functions it plays in both men and women. So function of the pelvic floor muscles are really crucial in both genders, and in women these muscles support the uterus, the bladder, the rectum during pregnancy and childbirth. And the strong pelvic floor muscles really help prevent any issues like urinary incontinence and pelvic organ prolapse. So where the organs can, in the prolapse, what happens is the organs can descend into the vagina, so they can fall down literally. We'll have an image just to let you know how a normal pelvic floor muscle looks while very well carrying the organs versus how a prolapse looks where the organs descend. So in men, the pelvic floor muscles play a crucial role as well, a significant role in maintaining urinary and bowel consistency. So they also contribute to sexual function, including controlling ejaculation and supporting erections. So keeping the pelvic floor muscles healthy is vital for overall well-being, and with regular exercises such as Kegel can really strengthen these muscles. So Kegels involves contracting and relaxing the pelvic floor muscles, improving their tone and function. And pelvic floor muscles are essential part, of the body's overall system, and it contributes to proper functioning of not only just pelvic organs, but also support other organs as well in terms of running and functioning quite well. And so as you understand their anatomy and functions, that can really help you be aware of these muscles and take care of them and guide your students to understand the importance of these muscles in maintaining their sexual health and also maintaining the health of the pelvic organs. So maintaining pelvic floor health through exercise and lifestyle choices can really contribute to have a more comfortable and active life for a long time. Now understanding how we can maintain the health of pelvic floor muscles and what support we can provide in order to keep them healthy. So during pregnancy, the pelvic floor health becomes even more critical as the growing uterus puts extra pressure on these muscles. And the pelvic floor muscles are like, reliable support system for the pelvic region. And they play a crucial role in ensuring smoother pregnancy and the childbirth. And as the baby develops in the uterus, it becomes heavier and starts pressing down on the pelvic floor muscles. And these muscles act like a hammock supporting the uterus and keeping it in the right position. If the pelvic floor muscles are weak or strained, they may struggle to handle this extra weight, leading to discomfort and potential issues also. So, maintaining a strong and flexible pelvic floor muscles during pregnancy is essential for many reasons. And the first reason is supporting the growing uterus. So the pelvic floor muscles bear the weight of growing uterus, bladder, and the bowel. So by keeping these muscles in good shape, they can better handle the increased load and reducing the risk of pain and discomfort in the pelvic region. The next is preparing for childbirth. As the due date approaches, the pelvic floor muscles play a vital role in preparing for childbirth. And they need to stretch and relax during labor to allow the baby to pass through the birth canal smoothly. And if the muscles are weak or overly tight, it can make labor more challenging or may even require medical intervention. Next is bladder control. So strong pelvic muscles help maintain proper bladder control during pregnancy. As the uterus enlarges, it can put pressure on the bladder, increasing the risk of urinary incontinence. And with well-toned pelvic muscles, pregnant women can have a better control on their bladder and reduce the chances of embarrassing accidents where they cannot just control their urine in maybe middle of social situations also. The next, it also reduces the risk of pelvic organ prolapse. So pelvic organ prolapse is a condition where one or more pelvic organs such as uterus, bladder, or rectum may descend into the vaginal canal due to weakened pelvic floor muscles. Hence, strengthening these muscles during pregnancy can really help prevent or minimize the risk of from this to happen. And as you can see in the diagram, the normal anatomy of how the uterus, bladder are well at the place versus when you see different organs prolapsing, then the way they are placed inside the pelvic regions just becomes shift. And worse is when the uterine prolapse happens. Then your entire the uterus comes and falls down into the vaginal canal, as you can see in the last picture in this diagram. So that's how crucial the pelvic floor muscles are in not only maintaining the child well-being during the pregnancy, but also sometimes the pelvic floor organ prolapse also happens after the delivery. So even a lot of doctors or healthcare providers recommend to women just after delivery to practice strengthening the pelvic floor muscles to avoid such things to happen. Now, the next is strengthening the pelvic floor muscles. So the power of Kegel and yoga practices for women's health during pregnancy is really there. I mean, they are really, really powerful tools that can really help mothers in maintaining their pelvic health. And as a woman embarks on a pelvic floor exercise journey, she may initially encounter challenges. Only being able, challenges might include like not able to be aware of the muscles or find the right muscles or be confused whether they are doing it right or not. So only being able to contract the muscles in pulses and finding it difficult to hold a contraction for extended period. That is also another, challenge that women faces. However, with perseverance, she can really improve her muscle control, and it takes a little time and mental preparation to know that all is going well. And if you cannot keep the muscles in control for a long time, it's okay. You can start even with few seconds. So beginning with basic exercise, mother can gently contract the vaginal wall muscles upwards towards the cervix and folding for a few seconds, and then gradually releasing and sensing the muscles relaxing downwards. And for a more advanced exercise, she can envision an elevator extending from floor to floor, pausing 4 to 5 times along the way. As she contracts the muscles, she strives for controlled steps, reaching the top and holding for a few seconds before releasing the same manner in downwards. So these exercises commonly is also known as Kegels, and they are highly recommended by physiotherapists, doctors and midwives due to their efficacy in strengthening the pelvic floor. So additionally, within the realm of yoga, 3 related practices involving the pelvic floor muscles are Ashwini Mudra, which requires contraction of anal sphincter. Second is Sahajoli Mudra, which requires contraction of the urethra. And the Mula Bandha, or the roof lock, which is the contraction of vagina, which mostly closely resembles to the pelvic floor exercise. So embracing these practices during pregnancy and incorporating them into a regular routine can really yield quite significant benefits for the mothers. And next is, by empowering themselves with the knowledge and the control over their bodies, women can really break free from the historical taboos and emerge very stronger, more informed and empowered. So the power of sensitive control over their bodies is the birthright of every woman, I believe. And as they honor and celebrate every part of their being, including the pelvic floor, women can really reclaim their autonomy and the well-being. So you also have an opportunity to really guide mothers, especially if you work in countries where the women's sexuality has been curbed, or women do not or are willing to really work on their anatomy in this manner. But really making them understand the importance of this would be a great role that you can play in their journey. It's also important to understand the pelvic floor dysfunction. So the pelvic floor dysfunction can occur during and after pregnancy and causing discomfort and disruption to a person's daily life also. So these dysfunction involves issues with pelvic floor muscles which may become weakened, tense or damaged due to the stress of pregnancy and childbirth. So first thing that can happen is urinary incontinence. So one common pelvic floor dysfunction is where women may experience involuntary urinary leakage. So during pregnancy, the growing uterus can press on the bladder, leading to stress, the urinary bladder, and especially when the women are sneezing or laughing or exercising. And after childbirth, the pelvic floor muscles may also be weakened, making it more challenging to control the urine flow. So it can happen during and after pregnancy. The next is pelvic organ prolapse. So this is another concern, and it happens when the pelvic organs, uterus, bladder, rectum, either of them can descend into the vaginal canal due to the weakened muscles. So pregnancy and childbirth can stretch and strain the pelvic floor muscles, and that's what increases the risk of prolapse. And next is pelvic pain. So it can occur during pregnancy or even after delivery during the postpartum period due to the tension or tightness in the pelvic floor muscles. And this may lead to discomfort and pain during intercourse as well, or also one may experience difficulty in the bowel movements also. And the next issue that can happen is fecal incontinence, where weakened pelvic floor muscles can also affect your bowel control, leading to fecal incontinence. This means that there can be accidental leakage of stool, gas, or difficulty controlling the bowel movements. The next dysfunction that can happen is called dyspareunia, and this refers to as pain that occurs during sexual intercourse, and it can arise from pelvic floor dysfunction as well. So tense or tight pelvic floor muscles may cause discomfort and pain during the intimacy. The next dysfunction is the diastolic recti. So although it's not directly related to pelvic floor muscles, but the diastolic recti is also a common condition that occurs during and after pregnancy, and it falls. We might have more in detail on this in the later chapters, but just to give you an idea, that it involves separation of the abdominal muscles, which can affect the stability of pelvic region as well. So it's really essential for the women experiencing any of these pelvic floor dysfunction to seek medical attention and guidance whenever required. And pelvic floor physical therapy is also a common approach to address these issues. And the pelvic floor physical therapist can really provide tailor-made exercises to strengthen or relax the pelvic floor muscles depending on the specific dysfunction. Now, how can we prevent these dysfunctions? So it can be achieved through, by one thing. First is pre-pregnancy care. So if we start early, start working on the pelvic floor muscles while you're pregnant, then it really supports while you're pregnant also, and also after the pregnancy. And these muscles will help with things like, the bladder control and supporting the body in many other ways. So starting pelvic floor exercises before pregnancy can really be helpful in the overall pregnancy and delivery, as well as postpartum journey of the woman. So if the women experience bladder leakage during the pregnancy, they are more likely to have, similar issues after childbirth also. So the growing baby's weight can really, sometimes put so much pressure that there are tears in the muscles even before giving birth. So these muscles are really important for supporting the back and preventing the pain also. So to really opt for safe exercises, women need to really be consistent in and engage in pelvic floor exercises in proper time, and also be aware of the pelvic floor muscles even in day-to-day activity, that can support and can help and contribute to the pelvic health. So they can so another thing that can happen, that sometimes when you are practicing pelvic floor exercises while there is a lot of urine in the bladder, that can lead to some infection. So this is an important point to know, that preferably if your urinary bladder is empty, and then one is practicing pelvic floor muscle exercises, then that is much safer versus exercising the muscles while your bladder is full. So just one note on that. And next would be, proper posture. So maintaining of good postures throughout pregnancy can also really elevate pressure from the pelvic floor muscles. Now, another thing that can help is the Kegel exercises. So the Kegel exercises will improve the pelvic floor strength and control. And another important thing to maintain, prevent this dysfunction is having a good postpartum care. So after childbirth, gradually easing back into your physical activities and seeking postpartum pelvic floor rehabilitation can also aid into the recovery. Next would be avoiding heavy lifting during pregnancy, and the postpartum can also reduce the strain on the pelvic floor muscles. So by understanding the common pelvic floor dysfunction that can occur during and after pregnancy, and taking proactive steps to address them, women can enhance their overall pelvic health and well-being. And it's important that they keep in mind that if things are going out of their hands and they are not able to control their urine or any other dysfunction-like symptoms are seen by the women, it's important that they seek medical guidance in that case and sought for some specialist in the area which can help them with this. Pelvic floor awareness in yoga practice is also an add-on tool that can be used. So empowering women to be mindful of their pelvic floor muscles while they are practicing yoga is also it's a great tool to begin with. That will encourage pelvic stability, and if pelvic floor muscles, one is practicing yoga asanas and they are aware of pelvic floor muscles, then it also enhances their yoga practice especially while they are pregnant. And so what they can do is really mindfully engage and relax these muscles even during certain asanas, and that will help them with promoting pelvic stability during the changes that occurs during the pregnancy time. So when the weight of the baby is growing and the hormonal changes are occurring, it can really lead to a lot of strain and tension on the muscles. So when they are practicing yoga, they can choose to relax the muscles consciously. So consciously inhaling, squeezing the muscles, whenever especially they're sitting or in a posture wherein there is time to do that, or they are into a posture where they can engage the pelvic floor muscles and be aware of them. That is a great way to relax release the tension on the muscles. So cultivating awareness of the pelvic floor muscles during the yoga practice really will allow the women to connect with these muscles in a deep manner and understand their sensations and functions better. So mindful engagement really helps with strengthening the muscles, which will again help them in maintaining the stability in the area, and also help them maintaining, avoid any further issues, any kind of dysfunctions that are related to the pelvic floor. Now, there are, many benefits of pelvic floor awareness, which includes enhancing balance and elevating discomfort, strengthening the muscles, and also, creating a very solid foundation for practicing other yogic movements also. For instance, during standing poses, if women are consciously engaging the pelvic floor, that will enhance their balance and alignment during those kind of yogic postures, and it will also reduce the risk of falling and injuries. So moreover, as the body changes during pregnancy, some pregnant women may experience discomfort or pain in the pelvic region also. So being mindful of the area will also help them elevate the tension and discomfort, as we discussed earlier also. Next would be Kegel exercises, and we have discussed about this, but this can really be practiced and be part of your yoga class whenever you are creating one. And to consciously including Kegel practices as part of your yoga class can really help mothers to take that conscious time to practice these exercises, and can also help them later on while they are not in a yoga class to be aware of the pelvic muscles and use these exercises whenever possible. That's what you should guide to the mothers. And especially even after when they have delivered and they're not yet ready to practice yoga, they can still start practicing Kegel exercises to prevent any kind of risk of dysfunctions. So another add-on that can be done is including and incorporating pelvic floor into yoga asanas in few more manners. So one would be breath and movement integration. So coordinating breath with the movement can also enhance pelvic floor awareness. And inhaling while relaxing the pelvic floor and exhaling while engaging, it can really create a deeper connection with these muscles. We can also practice gentle pelvic tilts, which, incorporating gentle pelvic tilts into the yoga practice sequences can really help the mothers become more attuned to their pelvic movements and sensations also. We can also practice certain restorative poses, and practicing these restorative yoga postures can be really helpful for the pelvic health also. Poses like child pose and reclining bound angle pose that can really provide an opportunity to focus on the pelvic floor relaxation and release. Next will be mindful engagement, and so encouraging awareness of the pelvic floor during standing postures or squats or lunges can really help in stabilizing the pelvis and maintaining the balance also. So it's really crucial that the pregnant women listen to their bodies and also at the same time avoid any overexertion during the yoga practice. So being mindful of pelvic floor also allows them to find the right balance between strengthening and relaxing these muscles and respecting their bodily changes that are occurring. And overall, pelvic floor awareness can, during the prenatal yoga practice, can really nurture a deeper connection with the body and the changes that are occurring in the mother's body. And it can also empower the mothers to embrace their journey with mindfulness and promoting pelvic floor stability and enhancing their overall yoga experience also. And yet you can, as a teacher, you should really adhere to understanding the fact that you are not the therapist. So as long as you can really support the mothers in enhancing their pelvic floor health and mindfully engaging them into pelvic floor exercises while being inside the certain asanas where it's really possible to engage mindfully in those muscles. But you should not at any point in time act as a therapist, because there can be some serious situations within the realm of pelvic floor dysfunction that might require medical attention, and we do not want to take risks with the health of the mother or the baby at any point in time. So your role should be really guiding safe yoga practices and help them understand the importance. But it's really it's important that the mothers consult with their doctors time to time whenever needed if they are facing any difficulty with any kind of dysfunction. So with that, I hope it helps, and this will really help to guide mothers more powerfully about their pelvic health and really contribute to their pregnancy journey in a great manner. With that, thank you and namaste.